Hello, my name is James Brent. I'm an MS4 now, and I'll be talking about changes in social inferencing and negative attributions after brain injury. To start with, here is some background. After experiencing traumatic brain injury, people frequently suffer from increased levels of anger and aggression. This could be caused by negative attributions that could be influenced by their social inferencing. During the rest of this presentation, I will talk about what negative attributions and social inferencing are. Negative attributions are the way we judge another person's action. The example that makes the most sense to me is when somebody hits you with a grocery cart in the store, and they almost certainly don't mean anything by it, but some could assume that it was on purpose and escalate the situation with an aggressive response. Social inferencing is the ability to infer others' thoughts, beliefs, and intentions. I'll explain more about the tacit later. For now, I just want to clarify that social inferencing is more than just determining happy, sad, or mad. It also involves figuring out whether people are being sincere, sarcastic, or lying. There is a need for this research because there are plenty of people who suffer from brain injury. Of these people, many of them have decreased quality of life because of their increased anger and aggression, leading to difficult situations in their social lives. To try and improve on this issue, a therapy program could be beneficial for people suffering from increased anger and aggression after their traumatic brain injury. The objectives we had were to observe how the intervention to change attributions that are negative affected anger and aggression as well as social inferencing. The other objective was noticing that anger and aggression changed in relation to the changes in their social inferencing. For the methods, this was secondary outcome analysis of a clinical trial. There were 24 participants with complicated mild to severe TBI that were greater than 1 year post-injury. 21 completed the study and 6 had no data for the AIHQ. The intervention I've been mentioning is called Intervention to Change Attributions That Are Negative, or ICAN. The ICAN is the first treatment to target hostile attributions after TBI, making it a novel anger and aggression management approach in this population. It is a 6-week group therapy in which, after recalling a personal situation in which others' ambiguous actions lead to an unpleasant outcome, participants will explore different perspectives. Sitting or standing in one position, they will explore their own thoughts and feelings, then move to a different position to experience the other person's perspective, eliciting their thoughts and feelings. Sports fans may recognize Antonio Brown in the picture here. I think he is someone who could benefit from the ICAN intervention. For those who don't know, he's a football player with a history of significant concussions who is battling an ankle injury and didn't feel like he could play during a game. His coach told him he's finished, as in done for the game. Antonio attributed this to the coach firing him, so he ran off the field jumping up and down and threw his jersey into the stands. This is the best celebrity example that came to mind when thinking about a way to show how after traumatic brain injuries, people don't always understand the messages being sent to them correctly, and then respond inappropriately, affecting their job and social status. The measures for this analysis were the Ambiguous Intentions Hostility Questionnaire, AIHQ, and the Awareness of Social Inference Test, or TACIT. The AIHQ was used to measure attributions of intent, hostility, and blame, as well as how angry and aggressive their response would be. It is a little more complicated than just checking a smiley face box. The AIHQ comprises 15 short vignettes selected to equally represent accidental, ambiguous, and intentional events, 5 each. The participant is then asked to determine the level of hostility, intentionality of the event, and they also rate how angry they would feel and how much blame they would put on an individual. Finally, they write down how aggressively they would respond to the scenario. The tacit comprises videotape vignettes of everyday social interactions and has 3 parts, each with alternate forms. The Emotional Evaluation Test, or EET, assesses recognition of spontaneous emotional expression: happy, surprised, sad, anxious, angry, disgusted, neutral. The Social Inference Minimal Test, SIM, assesses comprehension of sincere versus sarcastic exchanges, whereas the Social Inference Enriched Test, SIE, assesses lies versus sarcasm. In both SIM and SIE, speaker demeanor, like voice and facial expression, indicate the intended meaning of the exchange. Starting with the outcomes for the AIHQ, intent, anger, and aggression were significantly reduced after ICAN. Hostility and blame attributions trended towards improvement, though. The outcomes on the tacit did not significantly change post-ICAN, but on each of the tests, there was some improvement by greater than 1/2 of the standard deviation. Here we can see the changes in AIHQ related to changes in tacit, and we see that the changes from social inferencing minimal moderately correlated with changes in hostility, blame, and anger, and they strongly correlated with changes in aggression responses. Alright, so in conclusion, the ultimate goal of ICAN is to manage the anger and aggression in the TBI population. Some changes may be related to changes in social inferencing. More research should be done to observe these changes in negative attributions in social inferencing post-ICAN. Thanks for listening to me today. And here are the references that we used.